or people who are considering changes or have to help parents or other people to understand the basics so that you can know what questions to ask and know who to go to get some help. So if we can achieve those things, and I think you'll find this very valuable. Okay, Katrina, next one. All right, so in terms of understanding Medicare, I think what we're trying to communicate today is first, what is Medicare and who is eligible? The second is the 4 parts of Medicare, which you'll hear referred to as A, B, C, and D, and another one thrown in, which is called Medigap, which we'll explain. And third is programs for people with limited income and resources. So there is help out there to help pay for someone with Medicare. Anybody who comes in with the understanding Medicare is free, that's not correct. So we'll help you understand what it may cost you depending on what options you choose. Okay, next slide. Okay, so Medicare is a federally sponsored individual health plan providing coverage for medically necessary procedures and services. So it is not a family plan. So you cannot get a Medicare coverage that covers you and a partner, you and a spouse, or anybody else. Medicare coverage is individual. So if you have living with somebody else that needs Medicare, both of you have to apply and both of you have to enroll as individual plan. And Medicare coverage requires copays, coinsurance, and deductibles that are typically your responsibility. So that's why I said it's not free. It is a great benefit, but there are costs associated with it, depending on the plans you have and depending on the services you are taking advantage of. And we'll go through those things today. So a copay is basically a payment you make. For example, if you go to a doctor's office, the doctor's office may say, you have a $20 copay. We would like that money up front before they will see you. Coinsurance is usually a percentage of a fee, which is collected later. And a deductible is an amount that you typically have to pay before Medicare will start kicking in, paying their portions. Okay, next slide. Okay, who is eligible? Anyone 65 or older who participates in Social Security or the Railroad Retirement System is eligible for Medicare. Employees of federal, state, or local governments, or those whose spouses participated are also eligible for Medicare. If you are under 65 and have been awarded Social Security or Railroad Retirement Disability, you will get Medicare after 24 months of being on disability. And also those who have ALS, also known as Lou Gehrig's disease, or those who have end-stage renal disease are qualified to get Medicare. All right, so those are all the categories of individuals that can qualify for Medicare. Okay, so as I mentioned before, there are 4 basic parts that you'll hear referenced in this presentation, and when you look at information, when you receive documents in the mail or email from Medicare. So Part A is referred to as hospital insurance. So that covers you when you're admitted to the hospital. Okay? Not when you're in an emergency room, but if you have to go to the emergency room and they say, we're now going to admit you, then that's all covered under Part A. Again, there are copays, coinsurance related to that. So, for example, if you have to go in the hospital, you could have to pay $1,484 as a deductible each time that you go in the hospital during the year. Part B is referred to as medical insurance, which is basically everything that Part A does not cover. So that includes visits to the doctor, visits to diagnostic facilities like for blood tests or MRIs or X-rays, and those types of things. Outpatient surgery, outpatient services, anything that's not in the hospital is covered under Part B. Part C is referred to as Medicare Advantage. And Medicare Advantage is similar to what a lot of you may have had when you worked, in that it combines Part A and B. So instead of getting your Part A and B coverage from the federal government, from Medicare, you get your coverage from a private insurance company that is offering a Medicare Advantage plan. So it can be a HMO or a PPO, sort of like what you had in your work. It includes Part A, and sometimes it also includes Part D, which is Medicare prescription drug coverage. And we'll go into a little more detail as to what the Advantage plans offer versus the original Medicare. And Part D is Medicare prescription drug coverage. So for that, if you're an original Medicare, you pay a small premium, and then you get your medicines covered to some degree, depending on the types of medicines, where you are in a stream of costs. And that's the same as whether you're in original Medicare or if you're in Medicare Advantage. The difference with Medicare Advantage is that many of the plans include that premium. So Part C includes typically A, B, and D. And then original Medicare is A, B, and D as separate policies under the government. Okay, next slide. So this is a slide showing what original Medicare covers. So again, when we talk original Medicare, we're talking Part A and Part B. So you can see Part A is inpatient hospital coverage, nursing care in a facility. Please note that you must have been in a hospital for 3 days prior to going to a skilled nursing facility in order to get that coverage. It covers some home health care. So if home health care is prescribed by a physician, it will cover those costs. It covers hospice, and it covers blood costs. Part B are the services not covered under A. And if you had just Part B, then they would cover 80% of those costs. It also covers the physician services, as I mentioned, outpatient surgery and services, home health care, durable medical equipment, and blood. Just to clarify, home health care is not the same as long-term care. So long-term care is when you buy a policy and it covers you for future long-term. That's the result of aging, where you cannot do all the functions of daily living. So this is health care required typically as a follow-up to medical procedures, such as surgery or other hospitalizations. Okay, next slide. Now this is what's not covered by Medicare. So Medicare does not cover the outpatient prescription medications. So when you buy a Part D plan, you're buying that from a private insurance company, or if you're covered by a Medicare Advantage plan, that's through a private insurance company. It's not covered by Medicare. Medicare does not cover routine dental care. It does not cover routine vision care and eyeglasses. It will cover things related to eye health. So if you have to go to a optometrist or an ophthalmologist and they have to check you for glaucoma or retinal problems and things of that nature, that's considered eye health. But if you have to go and get a refraction or glasses, that is not covered. It does not cover hearing aids. It does not cover foreign travel. It does not cover cosmetic procedures and treatments. And it does not cover long-term care, as I mentioned before. So those things are not covered by original Medicare. Some of them are included as benefits in Medicare Advantage, or you can purchase policies, but they're not covered as defined by original Medicare. Okay, next one, Katrina. So what does original Medicare cost? So for Part A, most people qualify for premium-free Part A based on your work history. So if you or a spouse have worked for 10 years, and it does not have to be 10 contiguous years, or what they will refer to as 40 quarters, then, and you earned a minimum amount of money, then you will get Part A for free. And the reason you get Part A for free is because when we worked in our paychecks, there was a deductible called FICA, which was part of the payroll taxes, and that was contributions to Part A. So as long as you have enough work history, then Part A is free to you. If you have fewer than 40 quarters, Part A does have a monthly premium, depending on how long you worked. Okay, next slide. Part B, we did not contribute to when we worked. So there were no payroll taxes that paid the Medicare program any money for Part B. So as a result, when you join Part B, there's a standard premium, which is $148.50 a month. And you pay that whether you're on original Medicare or you're on Medicare Advantage. If you are a higher income individual, either as a single individual or a couple, then you could have to pay more. So if you earn more than $87,000 as an individual or $174,000 as a couple, then you're going to pay an adjustment, which is referred to as IRMA, an income-related Medicare adjustment amount. And again, income means everything that you get from investments, pensions, Social Security, anything that you may earn. So it doesn't have to be earned income. It's any income that's reported on your income tax statement. Plus, they add back any investments which are identified as tax-free. On the other hand, if you are a lower income person, then you may qualify for programs such as the Medicare Savings Program. In that program, you may get help in which the $148.50 a month will be paid for you. And that's something senior pharmacists can help you to navigate, to find out what your income and your asset level is, and to see if you're qualified for that benefit, which is paid through the Social Security Administration. Okay, next one. So this will just give you a quick look at the income adjustment table. So you'll see there that if you earned less than $88,000 or $176,000 as a married couple, you'll only pay the $148.50, the standard Medicare Part B premium. But as your income goes up, then you're going to pay more. So for example, if you earned as a couple between $222,000 and $276,000, then you would pay $297 a month for Part B as a premium, and you would pay an additional $51.20 a month for your Part D premium. And let me just make sure it's clear that if both you and a spouse are receiving Medicare, you each have to pay those fees. Okay, so you could be paying $297 for each of you, and an additional $31.80 for each of you if you made more than $222 but less than $276. So what typically will happen is Social Security will send you a letter, typically in January or something, to say, we just reviewed your taxes, and they review your taxes from 2 years prior. So in 2021, they are going to look at your 2019 taxes. If your income went down significantly in 2020, you can contact Social Security and ask to have an adjustment made, and they will ask for certain documentation. But this gives you an idea of what those adjustments may be. So if you fall into one of those categories and you get that letter, don't be surprised. Okay, next one. Okay, so in addition to the $148.50 a month, there's also additional cost sharing with Part B. Again, this assumes you have no other coverage. So there's an annual deductible of $203 a year. that you pay. So the first $203 of Medicare covered expenses you will have to pay. So if you go to the doctor and the doctor's bill is $200 and Medicare says we'll cover $100, you're going to be billed for that $100 until you reach 203. Then Medicare will kick in. In addition, Medicare covers 80%, as you mentioned before. So if you had paid your 203 and you ended up with a $100 doctor bill, you would have to pay 80 of it. Medicare would pay 80 of it. You would be responsible for the last 20. If you have additional insurance, that additional insurance would pay 20. If not, then you would be responsible for it. Just like if you had a MRI and that MRI was $2,000, then 20% of that could be your responsibility if you don't have additional insurance. Also note that you'll note it says that it's $0 for some preventive services. So there are about 30 preventive services that Medicare has identified that are mandated as being 100% paid. So for example, colonoscopies, mammograms, flu shots, things of that nature, which are annual wellness checks, all of those things, the deductibles do not apply to because Medicare considered as preventive to keeping you in good health. So those are zero deductible for those. Okay, next one. Okay, so let's talk about enrollment a little bit. So typically, if you're collecting Social Security before age 65, Medicare will send you a card to say that you've been enrolled in Part A and Part B, usually a couple of months before your 65th birthday. If you're under 65 and entitled to Social Security benefits, as it said, it'll send you A and B, but you do have the option to decline B. So for example, if you are working and your employer provides you coverage which is equal to Medicare, you can select to take your employer's coverage and you don't have to take the Part B. But you do have to notify Medicare if they have enrolled you to stop it. Otherwise, they will keep going on. And if you figure that out 2 years later, they will not refund you the money you had. They will stop it at the point that you requested. So you really need to pay attention to that. If you are turning 65 and not getting Social Security, Medicare will typically send you a Medicare card with just Part A on it. And it will indicate the effective date for Part A, or if you get a card with Part A and Part B. And that effective date is when your Medicare benefits start. Typically, coverage starts on the first day of the month. So if you are born on the 20th of February, then typically your coverage will start the 1st of March, as long as you've enrolled in time. The only exception is if you happen to be born on the 1st of the month, then they start the coverage the preceding month. Okay. All right, next slide. So this slide shows you what's called the initial enrollment period. And the initial enrollment period is the 7 months around your birth month. So you can enroll in Medicare starting 3 months before your birthday. So if you are born in April, you can start enrolling in January. Your Medicare insurance will become effective the 1st of April. If you can also enroll in the month that you're born, but then your coverage is delayed to the following month. So it's really important that you take care of that enrollment as soon as you're eligible, to give Social Security time to do that. So Social Security is the one that does the enrollment for Medicare. So it may be a little confusing. Okay, next slide. So if you did not enroll during your initial enrollment period, you do have another opportunity. So between January 1st and March 31st of each year, you can enroll in Original Medicare. However, if you wait till that long, your coverage will not begin until July 1st. So you could be, without Medicare insurance for up to 6 months. So again, it's really important. And again, if you talk to the folks at Senior Pharmacist, we'll make sure that's clear to you when you need to do the enrollments and also signing up for the other insurance. If you fail to enroll in Medicare when you're initially eligible, such as in Part B, you could end up with a 10% premium for the rest of your life for each 12-month period you're not enrolled. So for example, if you say, I'm healthy, I don't want to pay any of that deductible, and you wait 3 years, then you're going to be paying a big penalty, and that penalty is for the rest of your life, right? So if you waited 1 year, you're going to pay 120. You're going to pay a 30% penalty for 3 years of that 148.50. But remember, that goes up each year. So what your penalty is will also go up each year. So it's really important that you sign up when you're eligible. And again, if you're covered by an employer's plan, then you're not required to sign up when you turn 65. As it says there, it's waived when Part B is delayed because of EGHP, which is Employee Group Health Plan. So it's really an important date. Okay, next. In addition, there is what is called a special enrollment period. So for example, if a beneficiary or your spouse are actively working, they may be able to delay enrolling in Part B, like I mentioned. So if you're covered under an employer plan and you decide to work till you're 70, you don't have to enroll in Medicare Part B until you're no longer covered by that plan. Things to note: for a beneficiary older than 65, the employer must have 20 or more employees. So if you work for a small company, a small 5 or 10 person company, there's special rules that you need to be aware of. And if you are younger than 65, meaning you're on disability, the employer must have 100 or more employees. So you'll see as you get more and more into Medicare, it's filled with special rules and exemptions and time frames. So it's really important that you work with somebody to help you navigate through it. So once you lose your employer coverage, so let's say you stop working and you're not entitled to a retiree coverage, you need to sign up for Part B and Part D as soon as you can. For Part B, you have an 8-month special enrollment period to enroll without penalty. But again, the sooner you do, the sooner your coverage will begin. Some people, again, will wait, but it ends up costing you. For Part D, you only have 63 days to enroll in Part D plan without a penalty. And the penalty for Part D is 1% for every month you are not enrolled with Part D when you are eligible. And again, your plan will begin the first of the month following the month you enroll. So you want to make sure you're not getting a penalty, and you want to make sure you have coverage by signing up when you're eligible. Okay. So there's a few different ways that you can enroll. One, you can go online now to Social Security, SSA.gov, and you can enroll online. You can also call 1-800-772-1213, which is the Social Security office. And you can make appointments at the local offices through toll-free number. However, you need to check because the local offices have not been open due to COVID restrictions for about a year now. So those are available to you. That's something you have to do. A counselor cannot enroll you in Medicare or in Social Security. Okay, next slide. And here's what I was talking about, that due to the closure of the offices, Part A beneficiaries can fax their Part B applications to the phone number shown there. And you will have to include a couple of forms with your fax. One thing to note is when you separate from an employer and you're past 65, you will need to get a verification letter that said you were covered by insurance that was creditable, meaning it was equal to or better than Medicare, to avoid that penalty. So if you call up and you're 66, let's say, and you don't send anything in, Social Security is going to automatically assume that you did not sign up and start a penalty. So you want to make sure before you leave, you talk to your benefits or HR person. They're very familiar with this process. Everybody who leaves after 65 has to get one of those letters. Okay, next slide. Okay, so
Bruce,
Yep.
if you don't mind, before we go any further, since we can be a little more interactive, just before you get to supplements, Bruce has covered the original Medicare A and B and the cost sharing and how to enroll through Social Security. And any questions about any of this, you can unmute yourself and ask a question. He's going to talk about supplements, Medicare drug benefits, and Medicare Advantage plans up next. But any questions so far about enrollment or eligibility? Okay, perfect. Thank you. Bruce, continue on.
Okay.
Thanks.
So if you remember, we talked about original Medicare. In that original Medicare, there is a large deductible for hospitalization, and also that Part B only covers 80% of your costs. So in order to cover the rest of it, you can get what's called a Medicare supplement or a Medigap plan. So if you remember before, we said you went to the doctor and the doctor's bill that was covered by Medicare was $100. Medicare paid $80. $20 is your responsibility. If you have a Medicare supplement plan, then that Medicare supplement will pay that balance. The same thing if you had that MRI we talked about, which was $2,000 or $3,000, Medicare might say, we're going to pay $1,000 for it. So they'll cover 80% of it, or $800. The $200 would be your responsibility. So you can see if you have a serious illness during the year, those costs can really add up. So as an option, you can buy Medicare supplement or Medigap plans through private insurance companies, which cover up to the entire balance of what Medicare does not pay. You still will have to pay the $203 Medicare Part B deductible, but other than that, you would have no medical expenses for the year. So the plans are standardized to fill in the gaps, and that includes deductibles, copays, recurrent co-insurance. So you could go into the hospital and have a $300,000-$400,000 surgery and end up with no costs if you have Medigap plan. And the plans are designated by codes. So these are all defined and controlled by Medicare, but they're sold by private insurance companies directly from the insurance companies. So you'll see there's plans A, B, C, D, F, G, and so forth. Plans C, F, and F prime are available only to individuals who were 65 prior to 2020. So today, the most comprehensive plan is Plan G. So Plan G, you pay that $203 deductible for the year, but then all other expenses are covered. And the coverage is the same from company to company. So this is really important. When you start looking at this, you'll see the premiums vary. So for example, for a female, you can get a plan G for as little as around $93 a month. For male, around $103 a month. But those plans can go all the way up to $300 a month. The coverage is the same. The only difference is the cost. And that's something that, again, if you speak to a counselor, they'll help you understand that the coverage is identical. Okay, Katrina, next one. So there are other ways of getting secondary coverage. Some people might qualify for Medicaid. So that's for individuals with low income and very little in cash reserves. You may be a military retiree, so you qualify for what's called TRICARE for Life, and that's for retirees and dependent. There are certain federal and state plans for retirees and dependents, or there are employer group plans. So, for example, if you were an employee of the Duke Health System, they have a series of retiree plans. A lot of the larger companies and around here, the technical companies also have employer plans. So those are other ways you can get secondary coverage in addition to the Medigap plan that we just talked about. But if you have original Medicare, you really need some secondary coverage because there's no maximum to what you have to pay. So if you didn't have secondary coverage and had 2 or 3 hospitalizations during a year, you could be facing very large bills. So you want to protect yourself. Okay, next one. Okay, this is a little bit about, again, employer group plans that we talked about a little bit. Some employers offer a variety of coverage options. Like if you're a state employee, there's 3 different plans that you can choose from. They come in many forms and can be understood on an individual basis. So it depends on your particular circumstance. Just like when you're looking at original Medicare and Medicare Advantage, there's no one right answer for anybody. It depends on your particular situation, what your comfort level is, what your risk level is, financial situations. Some plans offer cash payments, allowing the beneficiary to purchase their own coverage. So a lot of companies now, rather than offering retiree plans, are offering their retirees a cash amount, which the retiree then can use to purchase whatever insurance they want. Some employers are now offering Medicare Advantage plans, making Medicare Advantage their primary coverage instead of original Medicare. In a lot of cases, the employer Medicare Advantage plan is better than the one you'll see offered through Medicare system because they offer additional benefits. And the best source for the employer plan, of course, is your employer benefits administrator. So you really need to, before you reach 65, several months ahead of time, really sit down and understand what plans they offer. Some plans will require you to purchase Part A and B. So Medicare becomes the primary payer. The employer plan becomes a secondary. Some employer plans don't require that. So you really need to understand that before you can make the best decision. Okay, Katrina? Okay, so now we're going to talk about Part C, which is Medicare Advantage. So again, these are plans that are approved by Medicare. So it's another way to get your coverage. It's still part of the Medicare program. So you can enroll on Medicare.gov just like you can for Part D programs, but they're run by private companies. And Medicare pays the plan an amount for each month member's care. So every month, Medicare is giving that insurance company money to take care of you. So that instead of going back to Medicare for A and B, all of that is covered by the insurance company. Now, some of the things, particularly Medicare Advantage, you may have to use network doctors or hospitals. So you need to check with the providers you use to see if they accept those plans. So for example, if you have a relationship with a physician, because of whatever reason, the long-term illness or something, that may be very important to you. If that provider says, I don't accept that plan, then you have a choice of changing plan or changing provider. So it's really important to understand what your providers accept. The types of plans vary from county to county. So again, in Durham, there are a certain number of Advantage plans. I think it was 21 this year. And those are applicable to people living in Durham. So don't talk to a friend of yours who lives in Asheville and they say, oh, this is the best, because again, it may not be best for you. Looking at Medicare really is about you making the best choices for you. And these plans are different depending on where you live. In addition, you can enroll in these in the Medicare open enrollment period, which is January to March 31st of each year, in addition to the annual enrollment period, which is from October 15th through December 7th. But there's a lot of unique things in Medicare Advantage plans that you really need to make sure you understand. And the reason being, if you decide to go in a Medicare Advantage plan and 2-3 years later, you say, it's not for me, I want to go back and get a supplement, you may not be able to get it because you will have to go through what's called medical underwriting. So they do not have to accept you, or they can accept you but charge you a higher rate. So you need to be aware of all of those rules and contingencies when making that decision, and be aware what options you have, such as within the first year, you can go back to original Medicare and things of that nature. And that's, again, why it's important to speak to somebody. Okay? Katrina? Okay, so when can you enroll in a Medicare Advantage plan? Well, again, during your initial enrollment period, remember that 7-month period, you can choose whatever plan you want within your area. Or during the open enrollment period from October 15th to December 7th, you can change them every year. So for example, every year, some of the Advantage plans may drop out of the area, in which case you get a new opportunity to select a plan. Your provider may say, next year, I'm not going to accept ABC plan. So that's an opportunity for you to choose another one. So October 15th to December 7th is open enrollment for Medicare Advantage plans and Medicare Part D plans. And you may be able to join other times based on special enrollment periods. So for example, if you move to a different county or state, or you moved here from a different county or state and your plan is not available to you anymore, you get a special enrollment period. If you qualify for Extra Help, which is a special program to help you pay for medications, you also have some special opportunities to change your enrollment, and there are several others. Okay, Katrina, next. So this is a comparison chart. It's a brief summary of the differences between original Medicare, which was A, B, Part D, and a Medigap supplement, versus Medicare Advantage plan. So original Medicare, the coverage covers Part A and B from the federal government. Medicare pays directly. You have your choice of doctors and hospital providers, anyone that accepts Medicare anywhere in the country you can go to. So if you're traveling and you're in Georgia and you hurt yourself, any doctor there that accepts Medicare, you can go to, and you have the same coverage. And generally, either you or the supplemental coverage pays the deductibles and coinsurance. So if you have a supplemental plan, then the company pays it. And you usually pay a monthly Part B premium, like we discussed for Part B, which is for 2021, it's $148.50 plus any adjustments you may have. On the Medicare Advantage side, the Part A and B benefits are covered by the insurance company, and they may include some additional benefits. So many of the Advantage plans have some dental coverage, some vision coverage, some hearing aid. You'll hear about others, meal delivery if you come out of a hospital, transportation, things of that nature. The coverage is again provided by private insurance companies approved by Medicare. However, again, as we mentioned, you have to use doctors and hospitals or other providers that are in the network, or you may have to pay more money. And you may have to pay a monthly premium in addition to the Part B premium. So in general, the $148.50, as I mentioned before, you pay if you're in the original Medicare or you pay in Medicare Advantage. There are some Medicare Advantage plans now that are giving cash backs to help pay for it, but in general, you're going to pay the same thing with the income adjustment. That applies regardless of which side you're on. And the other part is you do have to pay a co-payment, co-insurance for services. So depending on the plan, if you go to a primary doctor, you may have to pay between $5 and $25. If you go to a specialist, you may have to pay between $20 and $55. For general other services, many of the services have a 20% co-insurance. So those are other things. And on the Advantage plan, you could be liable for up to the maximum out of pocket for the year. So depending on the plan you choose, it could be between, say, $3,500 and $7,500 a year that you could have to pay depending on what happens to you during the year. Okay, next slide. Okay, so the last part is Part D, which
Bruce,
is
just a
Medicare
time check. We got
prescription.
Bruce, sorry, just a time check. We got about 8 minutes. So
Okay.
sorry, just to let you know. Thanks.
So anyone who's covered by either A or B, it can join a Part D plan. Again, like Advantage, the plans are sold by private companies. Each plan covers a group of medications, which they refer to as a formulary, and typically have co-payments for prescriptions and possible a deductible. And the plans and formula lists may change annually. So it's really important every year you review your Part D coverage, because what's covered this year may not be covered next year, or the coverage can be quite a bit different. Okay, Katrina? Now, as you mentioned before, there are programs to help people with lower income and assets. One is the Extra Help Program. The eligibility is determined by Social Security. It can reduce or eliminate your monthly premiums. It also can reduce prescription co-pays, provides an opportunity to change plans, and so forth. So again, that's something the people at senior pharmacists can help you determine if you're eligible for these plans and how they relate to some of the others. It's a great benefit if you qualify for it. Okay, next one. So enrollment in Part D, same thing during your initial enrollment period. During the open enrollment period from October 15th through December 7th, with the coverage beginning on January 1st. So you're choosing the plan for the next year. You may be able to join at other times, depending on your circumstances, either through the open enrollment period or a special enrollment period, such as if you get extra help. Okay. Next one. Okay, so I think we covered this before. This is just the differences between the Advantage and Medigap policies. So I don't think we need to go over that. Let's skip this one. Okay, so this is basically an overview of the choices we've been talking about. When you enroll in Medicare, you have two choices. to where you want to go. The left side is original Medicare. Part A and B, as we talked about, Part B will cost you $148.50 a month. The Medicare supplement, if you're 65, can cost as little as around $100 a month. And Part D, the premium can be typically $10 to $30, $40 a month, plus the cost of your prescriptions. The advantage there, again, as we said, you can use any provider. Medicare Advantage on the right side, that combines Part A and B, as we said. And many include prescription drug coverage. You also pay the $148.50, but many plans have a 0 monthly premium. However, it's a pay-as-you-go plan. So every time you go to a doctor, every time you go to a provider, have a diagnostic, any service done, a hospitalization, you pay some money. And as I mentioned, you have some exposure there into what's called a maximum out of pocket, which depending on the plan can be up to $7,500 a year. So the advantage is that, it's low or no monthly premium. And there are other coverages that it gives, like we talked before, some vision, some dental, hearing, meals, transportations, gyms, and things of that nature. So those are the two primary choices that you're going to have to figure out. Next slide, Katrina. So in terms of getting help, here are some of the resources. As Gina mentioned before, Senior Pharmacists has a staff of both pharmacists and ship counselors to help you navigate through it and understand what options you have. You can also call the state program, and they can answer some of your questions, or they may refer you to back to Senior Pharmacist, Social Security, or you can call Medicare themselves. Okay, any questions?
Next slide. I'm gonna do if I can, I'm gonna ask 3 quick polling questions, and then we'll get to your questions, because I know we're about out of time. So I'm gonna throw up a poll here, and if you all will, let's see, I can't see it, but can y'all see the questions? There we go.
Yeah.
Okay, if you all will take a little time to answer those questions. Do you see all 3 questions or just one of them?
All 3.
Okay, great. Thank you. Katrina, if you can get rid of the slides to stop sharing, if you would. Thank you, ma'am. Just as a reminder, as you're finished the polling, if you call Senior Pharmacist and need an appointment, Katrina's the one who'll hook you up. She'll be the one doing that for you. And I sort of oversee some of the appointments, but the other pharmacists do also. And we have wonderful volunteers, including Bruce, who might be your counselors, and we do it by appointment only. So, okay, so it looks like the 1 hour fits with people. People learned a little bit during the session, and just to go over this, what Senior Pharmacist does, we do insurance counseling, which is what we're doing today. We're the SHIP coordinating site. We do help people pay for medicines. This was a trick question. All of them are true. We do help people 60 and older in Durham pay for their medicines if they have more limited incomes. We do have pharmacists that do medication therapy management with older adults. And then we do have staff that try to refer people to services and programs that help them. So I'm going to, I can share the results. I can, y'all have seen them, the big results to them. So, okay, stop share results. So let's take your questions now. And if you can unmute yourself, we wanted to do this meeting style so we could be a little more interactive, and we just have a few minutes, but happy to answer any questions you have, or you can set up an appointment. And this is being recorded and will be sent to you.
So I have one quick question.
Sure.
Is a prerequisite for Part C, Part A and B?
Bruce, do you want to answer
Yes.
it, or you want me to?
Yeah, you have to be enrolled in Medicare in order to get Part C.
You have to have A and B to get C, because they replace A and B.
Right.
But you can have A or B to get a drug benefit. So to get a Part D benefit, you just need A or B, but to get Medicare Advantage, because they replace A and B, you need both of those in place.
Thank you.
Mm-hmm. A lot of people that are veterans will end up getting a Medicare Advantage plan because they go to the VA and they're fine going there, but they want a card that includes drugs and some of the perks. So they'll get a Medicare Advantage plan because they don't have to pay an additional premium, but they still would need to pay the Part B premium to get into a Medicare Advantage plan. Yeah, Richard.
Yes,
Yeah.
I had a question. Does Part D, does D stand for drug plan?
It does. And we need to edit our slides. We just changed our slides and we forgot to put the slide in there showing you the drug benefit. I'll actually pull it up on our website so we can show it to you. We somehow got that dropped off. Any other questions while we're pulling that up?
One thing that Gina, I wanted to mention, because somebody asked before about posting this, on the senior pharmacist website, there are individual videos on each of these subjects, which provides you a little more detail. So if you, for example, you just want some more information on Medigap, you can go to the Medigap video and it'll give you more details so you help you understand that. And each of the subjects are covered in those videos.
Yeah, in fact, what we'll do is, can everybody see here? I'm pulling up the website, our website. You can see our website here. Okay, great.
Yes.
So this is our website. And what we'll do, Katrina, if you can remind me, and Bruce, we'll just start showing our website at the beginning of meetings so people can see it. But if you click on Medicare and you click on About Medicare, you'll see some of what Bruce was talking about in terms of some of the, for some reason, things are super slow loading, but you can read about the different parts of Medicare and you can attend some webinars, that kind of thing. The other thing, this is what Bruce was referring to, that he and another wonderful volunteer that we have created all these videos. If you want to understand more about Part A or Part C or Part D, or if you have more limited income or a little bit of in-service on supplements, or what again are the difference between A and B. They're about 10-minute, 7 to 10-minute little videos on the details of these things on our website. And then we actually have links to all the plan formularies here. So if you want to see what all the different drug plans and what drugs they cover, if you go to your doctor and they want to prescribe something new and you didn't bring your book, they can actually go on our website and look up details for that. Let me go to About Medicare here, and I'm going to go to Medicare Part D, and I click on that. And oops. Wow, Katrina, we need to work with Jane. Here's the old benefit chart. We've got the wrong benefit chart. This is 2020, not 2021. How is that even possible? But anyway, this is the basics of the Medicare drug benefit. It's confusing, but the plan can have you pay a deductible. This year it's $444. I'm sorry, this is the old. I know we've got a new version on our website, but it clearly is not with all the links. And then the individual pays about 25%. The plan gives you a lot of help. The Part D plan you're in pays about 75%. And then you fall into what used to be called the coverage gap, where you're getting discounts now until if you and the plan together spend a lot of money on medicines, you end up falling into what's called the catastrophic level. And then you have to pay 5%, and Medicare stuff pays the rest. So it's a very complicated benefit. but we walk you through that depending on what medicines you're on. So let me stop sharing that, but we'll add that slide back to the picture. Other questions? We need to change our slides to say that the drug plans may change every year. They do change every year. It's not that they may, they can change dramatically every year. What drugs they cover, what drugs they don't cover, utilization management tools, meaning do you need prior authorization, step therapy? They can put barriers in the way from year to year and shift it around. So we really save people. And let's add a slide, this slide too, that last year when we looked at helping people, about 2/3 of the people we help with insurance need to switch plans. And they saved on average, how much do you think? Just on the drug plan alone, how much money do they think people save in a year by looking at their options? Somebody take a guess.
$500.
Good. More. $777 last year. This year, it's going to be even more, close to 900. So it's significant savings by comparing plans every year. So, good guess. Other questions for Bruce, Katrina, or myself? Thank you, Bruce. Thank you, Katrina. This will be on our website, and you'll receive an email with the link to follow up. And we hope you'll tell other people. And please, let us know if you have any other questions. And Katrina is the person you'll contact, and let us know.
Thank you very much. Great presentation.
Everyone.
Thank
Bruce
you.
is
Thanks so much.
terrific.
Take
We
care,
want him to
everybody.
do other presentations.
Stay safe.
Stay safe. Thank you.
Take care.
Thank you. Take care. Be well.
You too.